Hi everyone, Dr. Richard Tran here again at Color Chiropractic, giving you another interesting interview just with one of my colleagues. I'm pretty intrigued about this material here, and I've actually gone down to our guest's clinic a couple of different times to be able to see it. And it is a chiropractic clinic, but it's unlike any chiropractic clinic that I've ever seen. So I'd like to introduce you to the director of the clinic, Dr. Sarah Kotlerman. She specializes in regenerative chiropractic, really focusing on things like heavy metals, environmental toxicities, spinal ligament instability, and a whole lot more. She's also a professional speaker, writer, and the director of the Averio Health Institute. So welcome, Dr. Kotlerman.
Thank you for the warm welcome, Dr. Tran.
Yeah. Well, let's go ahead and go into it a little bit. Can you give us some background in terms of the overview of Averio Health Clinic, the missions, and even the goals that you have set?
The mission of Averio Health Institute from the very beginning was to provide the patient with more opportunities towards testing and care. We always had this idea, this philosophy that the body was designed to heal and regenerate. But as there are more mental, emotional, physical, chemical stresses on the system, it's taking a greater effort of care to get the same results that could have potentially been possible 50 or 60 years ago. So the Institute was created to fill that gap. It was there for the people who fell through the cracks, people who had conditions that were still reversible, still helpable, but they needed a greater amount of testing and care to get those results.
Okay. So it is going into maybe a deeper analysis that is often missed, I guess, in conventional medicine, correct?
There's only 24 hours in the day. Doctors, if they're limited to seeing a patient for 15, 20, 30 minutes, there's only so much that can get accomplished. When patients come to Averio Health Institute, they're on site for 5 days, all day, from 9 in the morning until 6 at night. This gives us an opportunity to really get an understanding of what's going on with their system. And we back up that understanding with a lot of tests that most doctors are not doing. We do provoked urine analysis. We do specialty blood labs like intracellular micronutrient panels. We do radiographic analysis. We look at thermographies. I'll look at other people's medical records of MRIs and CTs. But that's breaking these cases open, doing more testing and looking at where the weak areas of the body is and then treating it from a chiropractic perspective is giving people who previously did not have an option to get healthy again.
Yeah, for sure. I mean, going down to your clinic has been a really eye-opening experience for me because, I've heard, we share some different patients together, but I've heard about people staying there for those 5 days and being inundated with even multiple chiropractic treatments per day. I mean, I saw it myself too. How does that work?
Well, we use a very specialized technique. So the type of technique we're using is called Averio FNT. It's sustained contact. So unlike a chiropractic adjustment that creates a popping sound where there's a gaseous release, this is sustained contact. It's a purely neurological change that we're doing with the body. And we are probably one of the only facilities in the world that does pre and post x-rays after 5 days of care. The reason that we are justified in doing that is most of our patients are receiving at least 50 of these gentle, sustained contact adjustments within 5 days. The more complicated patients, where there may not be other modalities that we can use, are receiving more than that. Because the nervous system functions very quickly. We can check people minutes after an adjustment and realize that their body has adapted to that adjustment, has made the change, and is ready for the next adjustment. That's actually one of the challenges in these complex cases. When we're looking at patients who have different neurodevelopmental disorders or different neurological genetic disorders, they need more stimulus, more concentrated in order to give their brain a chance to respond. And our program gives that. We are checking patients constantly throughout the day if they need to be adjusted and then providing that care.
Okay, great. Yeah, it's really fascinating because often when we're taught in school, we kind of see these different X-rays and we see a lot of spinal degeneration, and usually the idea is that hey, that didn't occur overnight. It occurred over many years of time to the point where a lot of the symptoms that they're presenting with are a development of years of bad non neglect of care, but you're
Yeah,
able to get those results within like 5 days, and it's amazing. Like
yeah.
the spinal changes
Well,
is the proof.
remember, this is how the body works. We really can't take credit for it. Our job is just removing the interference from the central nervous system. Every single result that we've ever got was because that person's body had the ability to make that result. They just needed the interference removed. That to me is what the reason I get out of bed in the morning as a chiropractor, because we get to do this extremely important, unique work where we're not chasing symptoms, we're not chasing diseases, we're removing central nervous system interference and allowing the body to function as it normally would. And yes, you're absolutely right. We see degenerative discs reverse every single week. We see ligament instability reverse every single week. We see abnormal calcium reverse. One of our cases that we're going to publish internationally next year is actually going to be a complete reversal of ankylosing spondylitis. The patient started with 12 fusions. He's down to one fusion. Within the next 6 months, we anticipate there will be no fusions remaining from ankylosing spondylitis. Medically, within the drug culture, that's a permanent condition.
Yeah, yeah.
It's not a permanent condition, though, when you look at the problem from a chiropractic perspective of working with the body instead of trying to fight the adaptation to abnormal that we call disease in the body.
And I think too that the idea is that a lot of people go to chiropractors because of a musculoskeletal condition. I mean,
Sure.
but you and I know just through working with more of a holistic model of chiropractic that there's so much more out there in terms of what we're exposed to as well as what can bring out health. So that's why you tie in the toxicity, nutrition, emotional health, those types of things. I mean, what kind of changes might you expect from that?
Oh, that's a big can of worms. So, probably the biggest game changer we see within the realm of chronic inflammation is the work we're doing within toxicity. This is, if you'd asked me when I was in school, was I going to come out and help people remove uranium from their system? That I would have laughed. I would have said, no, I'm a chiropractor, I adjust spines, right?
Mm-hmm.
But it turns out that for some of these patients, to get the damage in their spine to reverse, you have got to address the toxicities because those toxins are hurting their brain.
Mm-hmm.
Those toxins are part of the reason why their spine is abnormal in the first place. Those toxins are part of the reason that their spine is breaking down so quickly.
Yeah.
Because we look at crazy things, Dr. Tran. I see toxicity burdens that have 50 or 60 separate toxins on them. We are in the wild west of what people are dealing with toxicology wise, and behind every single one of my unusual or complicated or genetic cases, we are finding a very significant tox burden. And interestingly enough, when we reverse it, we are seeing changes to those weird, unusual genetic conditions. We're seeing things like McCone Albright and palms and just weird 1 in a billion kind of cases of genetic disorder. And I think there could be a correlation between the toxins that people are getting exposed to and how this is affecting them on a cellular level, on a genetic level.
Mm-hmm. Mm-hmm. Very good. Well, because you and I have worked together, I know that it's not just the 5 days and you're done.
Correct.
And I can see that because, even though you might go to these different clinics that have such a huge amount of information, we all have to live in the world too. So how does
Yes.
follow-up care actually work in line with what you do?
Well, we are constantly referring our patients to outpatient chiropractors. That is a common recommendation. We are working with chiropractors in every single state of the United States and internationally so that our patients can get regular chiropractic care in between their weeks of care. You are absolutely right. Most of the cases we take on are bigger than 1 week of care. But what we found is the weeks build on top of each other. So that first week when people are starting with the chronic disease, what we're attempting to do is just get their body to stop breaking down, right? You have to bring the train to a stop before you can reverse it. Once we get into the second, third, fourth week, this is typically where we start to see tissue regeneration. And then the amount of tissue regeneration a person needs depends on how much damage they walk through the door with, to some extent. How old are they? How many stresses have they had on their life? Where is the damage in their spine? How substantial is it? All of that comes into their case management. But we are such proponents of them working with outpatient chiropractors, making some anti-inflammatory dietary changes. We teach our patients how to do neurological exercises. We teach them how to use icing. The goal of care, from my perspective, is to get the patient to where they don't need us as quickly as possible.
Right. Well, I know that you're working with a team of doctors there, so it's not just yourself. In fact, this is, you're actually the daughter of the original founder too, right? So
correct. This idea was originally my dad's, and I have had an opportunity to stand on wide shoulders, and that is absolutely 100% why we are here today, is because my dad had a vision. He had a vision to create an opportunity of more for our patients, and it's taken 12, almost 13 years, but we have realized it. And I imagine at some point in the near future, this methodology of care will be available in every state in the United States. There are already facilities. We do a lot of publishing in Australia, New Zealand, Southeast Asia. There are already doctors in those areas who are looking at our methods and going, we need to bring that there.
Wow.
It'll be interesting to see whether we get the next concentrated chiropractic facility in the United States or whether it's international, because sometimes it's easier to move things internationally. So we'll see.
Wow. Exciting. Wow. Lots of really good things. And just to be able to get people to be able to get more of your material or get in contact with you, what are some of the best methods if someone were to be able to seek care? Do you do consultations? Is website?
Absolutely. In fact, one of the things that is unique to us is consultations are free. Anyone can schedule a consultation and talk to one of our doctors absolutely at no charge. You need to fill out some paperwork, that's state law, but there is no financial restriction to getting a second opinion from our facility on your health concerns. Our website, www.averiohealth.com, amazing amount of resources. You can get a free copy of any of the cases that we've published internationally. The images to those cases are in the back. We've shown that things like spinal stenosis, arterial stenosis, degenerative discs, fusions, all are very reversible. The images are the proof to that. And we have a ton of educational resources on our website as well, all free. Go to the educational resources tab. We link everything we use, all of the different food, tea, kitchen equipment, clean beauty, water, air, everything that we have tested throughout the years and gone, this makes sense, this is reasonable towards a healthy lifestyle, is linked there for anybody who is willing to look. So there's great resources on our website. And if you have complicated health issues and you're ready to not be sick anymore, schedule a consultation. Let's start to have the conversation about what needs to happen in order to get you to where you should be.
Yeah, that's wonderful. Well, Dr. Kotlerman, I know that time is short. I know that you're in a busy day, as we all are, but it's great to be able to do these types of interviews with healers in our community. And I would, be able to encourage people that are watching this to be able to check out Dr. Kotlerman's work, as well as the Averio Health Institute. They are one of our referral partners. So, be able to check that out. And we hope that this interview has been engaging to you. Please like or share it with those that you feel could be. Hi, everyone. If you like what you saw, please give it a thumbs up, leave a comment, feel free to share, and subscribe to our YouTube station. If you have any questions or suggestions, we appreciate it. Just email us at info@colorchiropractic.com. And if you want to know more about our practice, go to colorchiropractic.com. We are Color Chiropractic. where healing is achieved through personalized care and collaboration.